Hi everyone, my name is Savannah Hilbin and I decided to do my evidence-based practice project over patient safety incidents and nursing workload. A little bit of background on this is in the United States, there are 700,000 to 1 million people that fall in the hospitals, and they can sustain injuries such as lacerations, fractures, internal bleeding, all of which can lead to extended hospital stay, infections, increased hospital bills, and continued workload for nursing staff, whether that's assisted personnel or nurses. Research shows that 1/3 of these falls that happen each year could be prevented. So, a little bit about the article. This research article was done in Latin America. They studied one hospital in particular. They had a total of 85 nurses and 157 nursing assistants that they analyzed, and the overall incident rate of patient safety risks was 71%, so that was pretty high. They specifically addressed whether they were looking to see if there was a link between workload of nurses and the occurrence of these patient safety incidents. As we already know, there's a big need for nurses out in the nursing field all over the world. In many hospitals, they are very understaffed, especially with times right now. Since, in March, I know a lot of hospitals had to let go of a lot of nurses because they quit doing elective surgeries, and so they were just cutting it down to like as minimal people as they needed. So now that hospitals are opening up, these nurses are having to have a whole lot more workload, a whole lot more patients than they would have before, just because they're understaffed. So this can lead to lots of problems, such as having to spend less time with each patient, so just getting your basic assessment, so you may miss things, or it also makes you feel kind of rushed and have hard time with your time management. So that's some things that can lead to all these safety incidents. The nurses are responsible for so many tasks during the workday, as we all know. They have to give medications on time, assess their patients, assist with daily living activities, and most of the time they have techs that help them with a lot of that stuff, which is awesome. But again, with how times are and how it can be just in a normal hospital, they may be understaffed just because there's so many hospitals, and sometimes it's hard to get people to work. So as we all know, going through school, safety is like one of the main things that they tell us about on the NCLEX and all the tests, everything. Patient safety is what's important, but it's also kind of hard when you've got so many patients to monitor and take care of, to kind of make sure each of them are staying safe if you don't have the time. So in this article, the main patient incident was that related to nursing was actually falls, even though it talks a lot about how medication errors was one of the main things, but they didn't find that correlated to nursing workload. They found that falls did, because probably like a lot of how I would be as a patient. If you need to go to the bathroom, you're not going to want to wait on someone if you've already asked for them to come help you, because a lot of them would rather risk falling than having an accident in their bed, because that can be a little embarrassing trying to have someone else clean up for you when you know that you can go to the bathroom, even if you aren't strong enough. So that's what leads to lots of falls. It was a little surprising as I was reading it that, the workload didn't really relate to medication errors, because that can kind of have a problem, but I guess it just more or less related to the fact that they, when you're rushed with time, you just kind of, rush giving meds, and sometimes, that's why it's important to check all those things when giving your medications. So a recommendation for nursing practice would be more research and resources dedicated to nurse staffing. This means more resources to help with staffing both nurses and nurse assistants, because with proper staffing, and patient to nurse ratio, the risk for hospital associated falls could be significantly reduced. That would be, less time that these patients are spending in the hospital and less time that they're having to, use their bodies to heal, and more time that they get to get out and, live their lives. So it's also important, I think one thing that they didn't note, but that I thought of, it was also important for them to evenly spread out those high workload patients, not to give like one nurse all those patients, even if we are short staffed, because that will help if you've got one person that you've got to do all the stuff for. But if you give it to some other, if you equally spread out all those patients, it'll help, with the stress and maybe help reduce some of those falls as well. I felt this article was very insightful, especially with everything that we're going through, and especially as we're fixing to go out and work as nurses ourselves. It's a good thing to kind of consider, to know when your patient is a fall risk, and to when you don't have help, if they need your help, doing your best to get there and kind of manage that into your time as best as you can. And it can be hard, especially as new nurses or just with a stressful day, but it's important to keep that in mind and to kind of help push for more nursing people to come in and get rid of that nursing shortage. But all right, thank you guys for listening. I hope you enjoyed, and I hope it was insightful.